It's a funny thing about luck.
Oh, how so?
Well, when you see a dog that lives to be like 15 with virtually no health scares,
Mm.
the owner almost never calls themselves lucky.
Right, they don't just chalk it up to good fortune at all.
Exactly. I mean, if you ask them why their dog is doing so well, they always point to a routine.
Yeah, a very specific set of habits.
And that's really what we're getting into in today's deep dive.
Yeah.
We are looking at this fascinating stack of veterinary clinic transcripts, mostly focused heavily on adult poodle health.
Which is great data, but, the mission here goes way beyond just one specific breed.
Oh, absolutely. We're decoding these profoundly unglamorous, highly effective daily routines that keep animals healthy.
I was thinking about this, and preventive health is a lot like having a top-tier IT department at your office.
Oh, that's a brilliant analogy.
Right, like when the IT team is doing their job perfectly, absolutely nothing happens.
Right, exactly. The servers don't crash, the Wi-Fi doesn't drop, your emails just send. It feels almost boring. You might even wonder why you're paying them.
Yeah, but that boring spate, that total absence of drama, that is the ultimate proof that the system is actually working.
Exactly.
And achieving that boring state takes, well, a tremendous amount of daily work behind the scenes.
For sure.
Because we are so conditioned, as humans, to associate healthcare with action.
Wow.
Like with rushing to fix something that is visibly broken or bleeding.
Right, the emergency room mindset.
Exactly. But true preventive care is quiet. It is the art of making sure the dramatic things just never have a chance to happen in the first place.
So whether you share your home with a toy, miniature, or standard poodle, or you're just, endlessly curious about the actual mechanics of long-term wellness,
Yeah.
understanding these preventative levers is going to completely shift how you view everyday habits.
It really does. But to understand those daily habits at home, we first have to establish the medical baseline, because you can't track a change if you don't know what normal looks like.
Okay, I want to push back on that just a little bit.
Sure, go for it.
Because I think a lot of people operate on the whole, if it ain't broke, don't fix it mentality.
Oh, all the time?
So let's say you have a dog. They're running around the yard, eating perfectly fine, energy's great, they're acting completely healthy.
Right, the dog seems perfect.
Yeah. So taking that dog to the vet, paying for an annual exam and blood work, doesn't that feel a little bit like trying to fix a car that's running perfectly fine?
It definitely feels that way until you realize what a veterinarian is actually doing during that exam.
Okay, so what are they doing?
Well, they aren't just looking at the dog walk across the room and, giving a thumbs up. A clinical exam is this highly tactile, totally data-driven process.
Right.
And it's designed to catch physiological shifts that occur months or even years before they become visible to you at home.
Oh, wow. So they're feeling for things we literally can't see.
Exactly. When a vet is palpating or pressing on a dog's abdomen, they are actively feeling the physical size and texture of the internal organs.
Like checking if something is swollen.
Yeah, they can feel if the margins of the liver are slightly enlarged or if the spleen feels kind of irregular. And they are tracking minute shifts in weight, evaluating baseline blood work to look for tiny elevations in kidney enzymes.
Or like changes in white blood cell counts.
Precisely. Because by the time a dog is visibly lethargic or refusing to eat, a disease process hasn't just started, it has usually progressed significantly.
Right, so the clinic is really where you set that invisible baseline. You absolutely need the data from when the dog is healthy so you can spot the deviation later.
You have to know the baseline, yeah.
And looking at these clinical notes, that baseline also dictates things like vaccination and parasite prevention, which, frankly, I always sort of assumed was mostly puppy stuff.
Oh, you mean like a one-and-done kind of deal?
Yeah, like you get your puppy shots and you're mostly good for life.
That is such a common misconception. But appropriate vaccination and parasite prevention are ongoing, lifelong requirements.
Really?
Yes, and the transcripts highlight that there just isn't a single universal rule book for this. It depends entirely on the dog's individual lifestyle, their geographic location, and their specific risk factors.
Okay, give me an example. Like how much does location actually change things?
Well, think about a standard poodle that goes hiking in the heavily wooded Northeast. That dog is facing a massive risk of Lyme disease and tick-borne illnesses.
Right, ticks are everywhere up there.
Exactly. So their preventative protocol is going to look completely different from, say, a toy poodle living in a high-rise apartment in a really dry climate.
Oh, I see. Because the high-rise dog isn't dealing with ticks.
Right. Their main risk might be heartworm transmitted by just one stray mosquito that gets in the elevator. A veterinarian evaluates those specific regional and lifestyle risks to build like a custom shield around that specific animal.
Which really makes a strong case for sticking with one trusted veterinarian, right?
Right.
Rather than just, popping into whichever clinic happens to have a convenient appointment time on a random Saturday.
Oh, continuity of care is a massively underrated preventative tool
How so?
because a lot of clinical value comes from noticing long-term trends. If a vet sees a dog year after year, they have this complete longitudinal chart.
So they can see the slow changes.
Yeah. Like imagine a 2-pound weight drop in a standard poodle.
Okay.
In a vacuum, to a brand new vet, that might seem completely fine.
Right. 2 pounds isn't that much for a big dog.
Exactly. But to the vet who has seen that same dog for 5 years, that sudden 2-pound drop without any diet change, that is a glaring red flag.
Oh, wow. Yeah, they can connect the dots that a fragmented medical history or even just an owner's memory would completely miss.
Totally.
It's kind of like having a dedicated financial advisor who knows your entire portfolio history rather than just asking a random bank teller for investment advice once a year.
That is a perfect way to look at it.
But, if the annual vet visit is the yearly financial audit where you check the big picture, then what happens at the food bowl is the daily compounding interest.
Absolutely. Moving from the clinic to the living room really changes the scale of impact.
Right, because you only see the vet once or twice a year.
Right. So, as vital as that annual visit is, maintaining a lean, healthy body condition is arguably the single most impactful healthcare decision an owner makes day to day.
I feel like people hear the phrase body condition and they just translate it in their heads to don't let the dog get fat.
Yes, that's usually the translation.
But these veterinary transcripts go so much deeper into the actual mechanism of why extra weight is so dangerous. It's not just about carrying around a heavy backpack of extra pounds that makes the joints tired, right?
No, it is so much more insidious than just mechanical stress on the joints. Though that certainly causes early arthritis, which is awful.
Sure.
But the medical reality is that adipose tissue fat is not just inert padding.
It's not just insulation.
No, it is an active endocrine organ.
Wait, really? Fat acts like an organ.
Yes. Excess fat tissue literally pumps inflammatory hormones and cytokines into the dog's bloodstream 24 hours a day.
Wow, 24 hours a day.
Yeah. And this creates a state of chronic, low-grade inflammation throughout the entire body.
Which sounds terrible.
It is. That inflammation degrades cartilage, it exacerbates respiratory issues, and it fundamentally alters the dog's entire metabolism.
So nutrition and exercise aren't just, like, lifestyle choices.
Not at all. They are active daily medicine that dictates the dog's longevity.
So how does someone actually measure this at home? Because especially with a breed like a poodle, that thick, curly coat can hide a whole lot of physical reality.
Oh, definitely. It's master of disguise.
Right, so you can't just rely on the number on the scale, can you?
No, you have to bypass the coat entirely and do a hands-on, tactile body condition check.
Okay, walk me through that. What am I doing?
Okay, first, you run your hands alongside of the dog's chest. You should be able to feel their ribs pretty easily without having to press through this thick, spongy layer of fat.
Okay, but you don't want them too skinny either.
Right. They shouldn't feel like sharp pencils under the skin that's definitely too thin, but they should be readily palpable.
Makes sense. What's next?
Second, when you look down at the dog from above, you need to see a visible waistline tucked in right behind the rib cage.
Kind of an hourglass shape.
Exactly. And third, viewing the dog from the side, you should see what's called an abdominal tuck.
Which means?
The belly should slope upward from the end of the rib cage toward the hind legs. It should not hang straight down parallel to the floor.
I love that. It's a completely free, highly accurate diagnostic tool that is literally at your fingertips every single day.
And yet it seems to be the area where owners struggle the absolute most.
Why do you think that is?
Well, we tend to use food as a primary way to show love to our pets. It's an emotional thing.
Right, it's hard to say no to those eyes.
Yeah.
But reframing portion control and daily exercise as like the highest form of healthcare, that's a difficult psychological shift.
It's incredibly difficult. But once an owner makes that shift, they drastically alter the trajectory of their dog's life.
Well, since we are talking about chronic inflammation, I want to zoom in on the specific anatomical quirks of the poodle that require proactive intervention.
Let's do it.
I really want to ask about dental care. Is brushing a dog's teeth really necessary?
Oh, absolutely.
Because I have to imagine a lot of people listening are thinking, this is just an over-the-top modern pet parent trend.
Oh, people definitely think that.
Yeah, most people I know just wait until the dog's breath smells terrible and then maybe, They buy a bag of those dental chews.
And that waiting for bad breath is a critical error in the timeline.
Really? Why is that too late?
Because by the time a dog's breath is noticeably foul, you are no longer in the realm of prevention at all. That smell, that is sulfur compounds being released by established bacterial colonies in the mouth.
Oh, gross.
Yeah. It means meaningful destructive disease is already present. The clinical consensus in these transcripts is totally adamant. Daily brushing is the absolute gold standard.
Okay, but let's be real. If someone is realistically only going to manage to brush their dog's teeth, say, 3 times a week, is that even worth doing? Or is it an all-or-nothing game?
No, 3 times a week still provides a highly meaningful benefit.
Okay, good to know.
Because the mechanical action of the bristles physically disrupts and removes soft plaque before it has a chance to calcify and harden into tartar.
And once it's tartar, brushing doesn't work anymore.
Exactly. Once plaque hardens into tartar, a regular toothbrush cannot remove it. And that tartar acts like this porous coral reef for bacteria, pushing up against the gums and causing gingivitis.
And this is where that concept of systemic complications comes in, right? Because the mouth isn't just a closed system.
Far from it. The gums are highly vascular, so when they are inflamed and bleeding from severe dental disease, every single time the dog chews, they are pushing oral bacteria directly into their bloodstream.
Wow, every time they chew.
Yes! That bacteria circulates and frequently sets up microscopic infections in the filtering organs, like the kidneys, or it can even attach to the valves of the heart.
That is terrifying. Neglected dental care doesn't just mean a dog loses teeth. It can literally lead to heart failure or kidney disease down the line.
Exactly.
Which makes it even scarier that this isn't an equal playing field across all dogs. The veterinary notes specifically point out that toy poodles are at a massive disadvantage here, and it's due to simple geometry.
It is a structural nightmare for them.
How so?
Think about it. A 60-pound standard poodle and a 6-pound toy poodle both have exactly 42 adult teeth.
Wait, they have the same amount of teeth?
Yes. So in the toy variety, the jaw is so incredibly small that those 42 teeth are just crammed together, often rotating or overlapping, just to fit inside the mouth.
Oh, wow. I never thought about that.
Yeah, and that dental grouting creates perfect microscopic crevices where saliva, food, and bacteria get trapped, and natural chewing action just can't sweep it away.
Right, so consistent home brushing is exponentially more critical for those small breaks.
Exponentially, yes.
But, home brushing isn't the finish line. Professional veterinary dental cleanings are a major part of these care plans.
Absolutely essential.
And I hear this from pet owners all the time.
Yeah.
They are terrified of the anesthesia.
Yeah, I hear that constantly.
Right. They want the vet to just scrape the tartar off while the dog is awake. Is it really impossible to do a thorough cleaning without putting the dog under?
It really is. So-called anesthesia-free dentistry is largely cosmetic, and it provides a huge false sense of security.
Why is it a false sense of security?
Because the most dangerous unseen periodontal disease, the infection that destroys the bone and actually causes tooth loss, occurs below the gum line.
Ah, so you can't even see it.
Right. And a veterinarian cannot safely or effectively probe, take necessary dental x-rays, or use ultrasonic scaling tools beneath the gums on an awake, moving animal.
That sounds like a recipe for disaster if the dog moves.
It is. Anesthesia allows the veterinary team to safely secure the airway, thoroughly assess the root structures, and actually clean out the infection that is threatening the dog's health.
It goes right back to that invisible baseline. The real danger is the stuff you cannot easily see. And speaking of dark, hidden environments where bacteria thrives, it's not just the mouth where that happens. Because poodles were originally bred as water retrievers, they have this anatomical quirk, their heavy drop ears, that creates the exact same kind of bacteria-friendly environment.
Yes. A drop ear essentially acts like a heavy insulating blanket right over the ear canal.
Like wearing earmuffs all year round.
Basically. It traps heat and moisture, creating this dark, humid incubator that is absolutely textbook for yeast and bacterial overgrowth. So they are significantly more prone to ear infections than, say, a breed with prick ears that stands straight up and get plenty of airflow.
Right, like a German Shepherd or something.
Exactly.
Well, my immediate instinct would be to just buy an ear cleaning solution and flush those ears out every single day just to be safe.
But the clinical notes specifically warn against doing that. Why is overcleaning a bad thing?
Because the ear canal is lined with incredibly delicate tissue. If you blindly pour cleaning solutions in there on a fixed schedule when the ear's already healthy?
You strip away the natural protective waxes, and you can actually cause the exact irritation and inflammation you are trying to prevent.
Oh, so you make it worse.
Often, yes. The biological needs vary wildly. Some individual dogs grow a lot of hair inside the canal and might need careful professional plucking and occasional cleaning,
Okay.
but others naturally maintain a perfectly healthy ear environment with almost zero intervention.
Okay, so if a rigid cleaning schedule isn't the answer, what is the proactive routine?
You conduct a sensory audit. You need to routinely flip that ear flat back, look inside, and genuinely smell the ear.
Wait, you actually want owners sniffing their dog's
I
ear?
do. It is highly effective.
Okay, I have to know, what are we smelling for?
Well, a healthy dog ear shouldn't have much of an odor at all. What you are actively monitoring for is a sudden, strong, yeasty smell. It's often compared to old gym socks or, like, baking bread.
Old gym socks, got it.
Yeah, and visually, you are looking for an explosion of dark, waxy discharge that looks kind of like coffee grounds or any excessive redness on the skin flap itself.
So you are basically establishing an olfactory baseline. You learn what normal smells like, so you know the second it shifts.
Catching those sensory changes early is the entire game. You want to identify that yeast bloom and get a targeted medication from the vet long before the dog starts violently shaking its head or furiously scratching at its ears.
Right, because by the time they're doing that,
By the time a dog is scratching and whimpering, they are already in significant pain and the ear canal is deeply inflamed.
we're trying to shift the timeline, right? Treating the subtle smell before the pain even has a chance to start.
Which is a perfect segue to the most visible, defining characteristic of the poodle. Grooming a poodle really acts as a Trojan horse, doesn't it?
Oh, I love that term for it. Yes.
You think you're just paying for a spa day or taking an hour to brush them on the living room floor to make them look pretty. But hidden inside that haircut is literally a full-body physical exam. That is the real hidden medical value of a non-shedding coat. Because poodles have hair that continually grows and mats if it's neglected, it forces an owner or a professional groomer to get intensely hands-on with every single square inch of the animal.
Right.
When you are parting the hair and brushing all the way down to the skin, or when a groomer is running clippers over the body, they are physically mapping the dog's topography.
So what specifically are they finding under all that hair?
Well, they are finding the new pea-sized lump on the ribcage that wasn't there last month.
Oh, wow.
They are uncovering areas of redness, hot spots, or skin irritation caused by a hidden flea infestation that you'd never see otherwise.
And these transcripts mention something about sebaceous glands, right?
Yes. The clinical transcripts specifically note that poodles are prone to sebaceous gland issues. These are the tiny oil-producing glands in the skin.
Okay.
And when they get clogged, inflamed, or hyperactive, they can form benign tumors or cysts that are really easily hidden under a thick coat. So a professional groomer who sees the dog every 4 to 6 weeks, supplemented by an owner brushing the dog multiple times a week, it creates this tightly woven safety net for catching these dermal changes.
And, while you have the dog right there in front of you, holding their face to brush their top knot, it's the perfect opportunity to monitor their eyes, which, again, these veterinary notes flag as a specific area of vulnerability for the breed.
They definitely do. Poodles carry genetic predispositions to progressive eye conditions, which includes things like cataracts and progressive retinal atrophy.
Okay. But ongoing eye monitoring at home isn't about the owner acting as a veterinary ophthalmologist.
No, definitely not. It is about staying highly observant to behavioral and subtle physical changes.
So give me the practical checklist. What am I looking for when I'm staring into my dog's eyes?
Behaviorally, you are watching for hesitation in unfamiliar environments, especially in dim lighting.
Like at night.
Yeah. Is the dog suddenly reluctant to go down the stairs at night? Are they bumping into the coffee table when the lights are low?
Got it. And physically.
Physically, you want to look directly into the eyes in good lighting to check for any new cloudiness or opacity in the lens. You are watching for persistent colored discharge that wasn't there before, or any increased squinting or pawing at the face, because that indicates pain.
And if you see that cloudiness or notice that hesitation, you don't jump on the internet to try and diagnose it yourself.
Please don't.
You package those specific observations and bring them straight to that trusted veterinarian we talked about at the beginning.
Sure.
You provide the daily lifestyle data, and they provide the medical analysis.
Exactly. When you combine the owner's daily observations with the veterinarian's clinical tools, you create an incredibly robust healthcare system.
When we step back and look at this entire blueprint, the underlying philosophy is just so clear. The healthiest adult dogs are not the product of one massive heroic medical intervention.
Yeah, they really aren't.
Longevity isn't something you achieve in a single dramatic moment on an operating table at an emergency clinic.
It is the compounding result of small, consistent, highly connected habits.
Right.
It is the discipline of maintaining that lean body condition to prevent systemic inflammation. It is the unglamorous reality of daily dental care to protect the heart and kidneys.
And smelling the ears.
And smelling the ears. Yes, routine sensory checks,
Right.
maintaining accurate longitudinal records with a single vet, and really utilizing grooming as an ongoing full-body skin audit.
It all works together to maintain the quiet. If you are taking notes on how to keep an animal, or frankly, any biological system thriving, write this down. Prevention is quiet.
It really is.
If you are doing it right, very little actually happens. The absence of a problem, the profound lack of drama, that is exactly what success looks like.
The boring state is the victory condition.
And I want to leave you with a final provocative thought to mull over as you go about your day. We have just spent this entire deep dive looking at how a dog's long-term health and vitality are so heavily dictated by these tiny, daily, profoundly unglamorous preventative routines. We understand that waiting for the dog to be visibly sick is a failure of the system. But it really makes you wonder, how much of our own human health care are we treating reactively instead of proactively?
That is a great question.
We wait for the tooth to throb before we go to the dentist. We wait for the knee to fail before we seriously evaluate our own body condition and inflammation levels. What invisible daily routines should we be performing on ourselves right now to ensure a quiet, uneventful medical future?
Honestly, we might all benefit from treating our own biology a little more like that well-managed IT department.
Yeah.
Keep the servers humming, monitor the tiny system alerts before they become crashes, and really learn to truly appreciate the beautiful, boring silence of a system that is working perfectly.
Perfectly said. Thanks for joining us on this deep dive. Keep asking questions, keep checking those invisible baselines, and we will catch you next time.